Hello, a warm welcome to you all. Today, I am here to share my clinical experience regarding Ajeerna. Let me share my screen. My salutations to my gurus. Today, in clinical practice, usually we come across majority of lifestyle diseases. We all know that, including allergies, thyroid dysfunction, diabetes, autoimmune diseases, hormonal imbalance, high blood pressure, etc. etc. They are deep rooted in our lifestyle issues. Similarly, we also come across the patients who are infants, kids, children, and they suffer from recurrent respiratory or gastric infections, and uh, there is the stop to the antibiotic treatment. So they need a holistic solution. What is a holistic solution? We all know that the root cause is completely treated, and the complete restoration of wellness is what we call a holistic solution. And it is a complete treatment or Samyak Chikitsa, Mule Kuthara and Dhatu Samyak Kriya. So, what it is, the main root cause we call is uh, indigestion or Ajeerna caused due to Manda Agni. न जीरति सुखेन अन्नं विकारान् कुरुते अपि च तद् अजीर्णमिति प्राहुः तन्मूला विविधा रुजा. So that is the root cause of many diseases, various diseases. It is what we have all learned. So maintaining the agni or gut health is the major treatment. Here I am going to share these 4 cases with you. Whatever I could do, I could treat them. I'm putting in front of you all. The first case is a male child. He had bilateral vesico-ureteric reflux since his birth. It is congenital, and it was grade 4. He had high grade fever due to recurrent UTI and tortuous and dilated ureter, especially left one, and pelvic calyceal system dilatation as well. He had significant post-void urine as well, and which was the cause of recurrent UTI, uh, which showed innumerable pus cells at a stage. And the child was recommended kidney transplant at the age of 8. So the patient approached for any alternative solution. The clinical signs and symptoms included are enlisted here. You can very well see the involvement of 3-4 srotasas, Mutravah, Annavah, Rasavah, and Raktavah. And accordingly, I classified the symptoms and divided into Panchamahabhutas. So before the treatment, all the clinical symptoms are shown in red, and after the treatment, the clinical symptoms are shown in green. You can very well see how he responded to the treatment properly, and it started with the resolving first Annava and Purishava Srotasa symptoms within 1 month. So you can very well notice that the Annava and Purishava Srotasas are the one whom we generally focus on during or at the start of the treatment. So Agni Deepana Pachana Anuloma treatment yielded this result. You can see the urine report before and after treatment as well. Before the treatment, the patient had E. coli count suggestive of UTI, and that was innumerable. Ultrasound reports every 3 months are mentioned here. 3 months, 6 months, 1 year, 2 years, 3 years, 4 years, 5 years, 6 years, 7 years, 8 years, 9 years, 10 years, 11 years, 12 years, 13 years, 14 years, 15 years, 16 years, 17 years, 18 years, 19 years, 20 years, 21 years, 22 years, 23 years, 24 years, 25 years, 26 years, 27 years, 28 years, 29 years, 30 years, 31 years, 32 years, 33 years, 34 years, 35 years, 36 years, 37 years, 38 years, 39 years, 40 years, 41 years, 42 years, 43 years, 44 years, 45 years, 46 years, 47 years, 48 years, 49 years, 50 years, 51 years, 52 years, 53 years, 54 years, 55 years, 56 years, 57 years, 58 years, You can go through it. I'm not going into details. Um, Diagnostic investigation of VUR is micturating cystourethropy that confirmed that dilatation was completely resolved and VUR was resolved. It was again reconfirmed by DMSA renal scan. This case marks an important landmark in my clinical practice, and that showed me a ray of hope that any treatment which focuses on the root cause can resolve even complicated illness. So, being a root cause being the Agni-mandya, and the result of we can see that the complete restoration of wellness is visible. So, the mantra is treat Ajeerna and increase the probability of successful treatment. So, this case after this case, I started looking for uh, Ajeerna symptoms in each and every patient. Here comes the second one, which is this is an analysis of recurrent chronic upper respiratory infection in kids. You can see in this graph that three categories, I divided them into three categories. Intake category, no food intake category, digestion problems, those kids who had indigestion issues, those kids who had elimination issues like malavashtamba, malavrod, hardness of stomach, etc., etc. So the percentage is visible, and I could very well know that the kids had very well kanksha or food desire and bubuksha or good appetite around 73% kids. That means this is a case of incomplete digestion. Amongst all those kids, Pranavasruta Vikruti was found to be maximum. 65% patients suffered with Pranavasruta Vikruti. And they had Anannabhilasha, Pratishay, Kasa, Jwara, Malakaঠিnya, all these symptoms in dominance. You can see the kids being treated as earliest as 3 days to 7 days of treatment. They responded really very well, and gradually the recurrence stopped, and the kids were given rasayana, and they are now happily and very healthily growing well. So we can summarize that increased guru, manda, shita gunas may contribute to the indigested or partially digestion of ahar rasa, but that gives fullness or compactness to the food or the matter in the gut, and the result is agni-mandya and obstructive pathology. The patient feedback speaks a lot about it. Up to 73% patients of Pranavasrutas recovered in first 3 to 7 days of treatment. Ajeerna formed the basis of health problems. Avoiding Guruta is the key to prevent further disorders, was very well accepted and acknowledged by patients or and their parents as well. Increasing self-awareness of increasing self-awareness about pachana or metabolism or digestion in children can lead to build up a healthy society. These are the observations and this is the feedback. So prevention is better than illness is what the parents could observe. Then the third one is reversal of diabetes. This is a male 54 years with uncontrolled diabetes, having HbA1c more than 9.8 or 10 always in spite of anti-diabetic medication since 25 years. He is on antihypertensive medication as well, and BP fluctuating between 130, 120 and 80 to 90 mmHg. The patient experienced work-related stress, and he has a history of frequent air travel. Abdominal bloating was the only sign he could say in indigestion, and more than 30 years he was experiencing that in spite of following necessary dietary regime and strict sugar control. He had Kanksha, Bubuksha, both desire for food was there, appetite was also there. No complaint of constipation or any related breast elimination problem was notified. Tendency of dry irritating cough, especially between October to March since more than 10 years, was what he complained about. So the provisional diagnosis was impartial digestion due to stress and travel, leading to improper waste elimination and the waste being circulated in bloodstream, resulting in insulin resistance. Though, so the treatment included stress management and Shodhana as well. After Shodhana Basikram, that is Kala Basikram and Sarvanga Snayana Svedana and Shirodhara, you can very well see the observations here. I have charted for you. uh, Initially he was on three different medications, and at the end of the treatment you can see that he is having only one, and that too half dose and only once a day. Okay. And the gradual decrease in HbA1c also is visible. You can very well see that HbA1c and mean glucose reduced considerably from 234 to 124 in a span of almost a year, or one and a half year, we can say that. As soon this lockdown has helped in probably to stabilize the sugar levels due to the stop in travel, and although stress was always there, but the air travel was reduced a lot. So probably I call this a blessing in disguise, and he is now maintained at lower HbA1c and with Ayurveda medication like Falatrikadi, Gogula. So these all this was a complete reversal of diabetes, and the treatment is still going on. The insulin resistance was very well um, um, resolved. You can see how the fat percentage, visceral fat percentage, body weight, subcutaneous fat being decreased during the course of treatment. And especially the smooth muscle or lean muscle mass is increased. So body composition analysis is definitely suggestive of increased insulin sensitivity. And we can observe that incomplete digestion can be a probable cause of lifestyle diseases, because as we treated this, the reversal is the result is in front of you. So we can say uh, this same uh, uh, fundamental principle can be applied to many more diseases. Like one case was with mild to moderate COVID-19 with all the comorbidities. The patient contracted my COVID after almost 5 months of my treatment. And when we started the treatment in December, he had so many comorbidities. You can see HbA1c, lipids, hypertension, thyroid dysfunction, CRP, SGOT, SGPT raised, uric acid was raised, renal calculus are there present. These were all being treated since 5 months. And apart from that, he had chronic indigestion, chronic constipation, bloated stomach, burping, no desire for food, mild breathlessness, everything contributing to indigestion was noted. And these indigestion issues were resolved during the course of treatment. And then he contracted COVID. And how he recovered? He recovered without any complication, just within 10 days of only Ayurveda treatment, even if he was having raised interleukin levels. The provisional diagnosis, as I had done, chronic indigestion along with stress and sedentary lifestyle was there. So for the 5 months, I treated him for um, improper waste elimination, insulin resistance, and to get the read of the all the biochemical markers. So before COVID infection, he was on Ajeerna treatment and thyroid treatment. During COVID infection, he was symptomatically treated with the Jwaragna and Kasagna medicines simply. and the result is he complete recovery within 10 days. So the observation led me to think that if incomplete digestion is taken care of or well treated, then the biochemical markers show significant reduction. And moreover, the improvement in immune function is also noticed. So, in spite of being so many, having comorbidities, so many, he was completely recovered. So, what is this pathology of incomplete digestion? Whatever I have observed clinically, I am putting forward. So, overeating, unhealthy food, untimely intake of food, along with stress, uh, leads to incomplete digestion. The digestion is completed because the food intake is normal, because the patient or the person feels like eating every time. But at molecular level, the digestion of the ahara rasa is uh, observed to be incomplete, leading to improper formation of nutritive biochemicals. Those biochemicals, when stagnated or they are not eliminated out of the body, form waste in our body. That may result in constipation or delayed elimination of waste or sluggish elimination of waste. This leads to absorption of waste. The waste matter gets into circulation, reaches liver, spleen, kidneys to get detoxified, and eventually get rid of rid from the body. Again, the saturation level if is higher, and the causative factors like overeating, stress are always there, then the process continues without reverting, and the accumulation in liver and spleen and detoxification process is incomplete many a times, which is carried out in liver, that leads to tissue metabolism dysfunction. And finally we can see that biochemical markers are uh, uh, in blood, circulated in blood, which we call as lifestyle diseases. And these, if left untreated, the toxins get stagnated, resulting in continual indigestion. And the blood gets enough of toxicity. We all know that blood is the, uh, from the prasada bhag or the best part of blood, multiple organs get their nourishment. You can see yakrut, pliha, pupus, brukka, antra, guda, basti, hriday, जिव्हा, वृषण, आर्तव, कंडरा, सिरा, उंडुक. These are main functioning organs of our body which get nourishment from the best part of Rakta Dhatu. So once this Rakta Dhatu gets uh, toxic or Visharupa, we can say, these toxins provide and give undernourishment to these organs, and over the long period this undernourishment causes organ dysfunction. This is what I have now, now observed, and I am putting it in front of you. So what happens next? We get few signs and symptoms clinically we can observe. As soon as we wake up in the morning, we feel drowsy, or we feel weak even if we have had good rest. The patient complains of fatigue, weakness for the whole of the day, uh, feels sleepy, and then he sleeps in the daytime, and it may cause him disturbed sleep at night. Mood swings, anxiety, the enthusiasm is less, brain becomes foggy sometimes, we are not able to act smart. That may result in constipation, or the bowel movement is sluggish. It urine output also gets hampered, maybe scanty, maybe frequent, or a more concentrated urine is seen. Increased thirst is seen, leading to dryness of throat as well. But when the water is taken, the stomach becomes full instantly. That again causes heaviness in chest, and due to all this, the appetite is lowered, the taste is lost, or food craving is there sometimes, because normal food we don't want to eat normal food, we crave for our favorite food. Then while eating all those things, the abdomen gets bloated, sometimes gargling sound is experienced, and overall there is a heaviness in stomach and body. Many a times we find that even after cleaning the tongue is coated, and the constipation causes burping, which is relieved by either antacids or over-the-counter medications. There are farts as well, and sometimes heartburn is there. These are hyperacidity symptoms, which patient generally uh, considers that it is a part of life. So many a times he misses out to telling us it is not being a part of major complaints, but we have to dig down the uh, history. Headache is there sometimes, giddiness, sometimes nausea, which is relieved by vomiting, and there can be a raised body temperature or feverish sensation. And along with that, typically the patient complains of smaller joint stiffness, especially in the morning, or back stiffness, or neck stiffness, or any joint with stiffness, and that aggravates in the morning. So these are what I have enlisted and observed signs and symptoms clinically. What are these? In our classical text, what is this described as? This is not complete digestion. That is something different from Ajeerna and all those Kaphaja, Vataja, Pittaja, Ajeernas. This is different and is correlated and is described as Rasa, Shesha, Ajeerna. Meaning, the Shesha Bhaga or the remaining part of the formed Ahara Rasa, but incompletely digested form aparinata lakshano rasaha. So ahar rasa, which remains partially digested or incompletely digested. That ajirna is called as rasa shesha ajirna. We get so many references regarding this rasa shesha ajirna, and they have warned that it is sarva amaya kshobanam, bahu vikarakari, and becomes visharupa. That means once it becomes toxic, it may cause many diseases, and it may aggravate the existing disease as well. And even if this ajirna is there, the person feels like eating, because swalpam yada dosham vibaddham amam leenam na tejapatham avrunoti, because the indigested part is so small that it does not uh, affect the digestion or the appetite of the patient. Okay, so but it is capable of creating so many symptoms. I have enlisted all these. These are total almost 33 to 35 symptoms. That means this itself is can be called as a mm, independent vyadhi or independent disease. So incomplete digestion can be correlated to Rasashesha Jirna, and it can be called as molecular level indigestion. That may accompany doshaja ajirna or may not accompany with it. Even if in the absence of doshaja ajirna, it may result, and hence it is very tricky to find out if we don't dig up the history. Not elaborately well described as Swatantra Vyadhi, but can be identified in clinical practice as a root cause, as an associated factor in many diseases. So it is toxic in nature. So it has potential as a root cause of various diseases. Hence, it needs to be treated, identified, first identified, then treated completely and carefully. So what is it? The thorough history taking is the key. We have to just scan the patient thoroughly. And what is thorough history taking? It is tapping the individual body functioning. Like what is his sleep habits? What is his eating habits? How does he feel after eating? Does he feel fullness of stomach after eating? Has he taken the food after completion of after digestion of earlier food? All these things need to be inquired in depth. So what usually I do, I make aware the patient and make them watch their body signals, like getting urgency of bowel movement early in the morning whenever they wake up, feeling freshness in the morning, then no feeling of fullness of stomach even after 2 to 3 hours of the meal, then feeling hungry after 6 to 7 hours of earlier meal, then generally feeling lighter. These are all good digestion symptoms, and I insist them to watch all these symptoms so that they themselves can observe is that is there part of the food or the ahar rasa remaining undigested. These symptoms need to be followed up properly every time, and they also help us to understand the chronicity while of the present illness while diagnosing, and also they help us to know the disease prognosis as well, because as early as 3 to 7 days we get the result. We see that the patient is improving, and we can give a confidence to the patient that definitely you are going to be well soon. Okay. Furthermore, they give deep insight into the body signals of that patient, and he himself can keep the wellness uh, of his own. And sanchaya aparuta dosha na labante uttaragati, we know that. So whenever he finds a slight change in his system, he notifies us. This is what I have experienced, even in case of kids as well. Even kids also, I have seen that they watch their tongue, they watch their appetite, and they tell their mama, no mama, I'm not going to eat now because my earlier digestion is not over yet. So this awareness is helping kids as well, and we all can be aware about this type of indigestion, which is very very important. So what is knowing our gut is very important, we all know, and this is a good way to find solution to current lifestyle diseases. Probably an extensive study, a research study, or a wide database may help us to resolve our current problems of lifestyle disorders, which are posing a great threat globally as well. They are silent killers, and we need to be aware about all these diseases upcoming every day. And thank you so much for giving me this opportunity to share my information, and hope this information helps you all in clinical practice. Thank you so much.